Hi everyone, I'm Yo and this is Virginia. Welcome back to our YouTube channel, Knowing, Caring, and Loving Your Lady Parts. So today I have probably one of my really important videos that I want everybody to stay tuned into, whether you have any of these symptoms or not. And it's about preventing and managing and treating pelvic organ prolapse or POP. And that's when one of your pelvic organs drops lower than it should be, or even just slightly. Because I see so much of this in my clinic now. The prevalence is astounding. And I want to make sure all you women out there know how to prevent this, because our bodies change as we get older. And let me tell you, it is not fun. So please stay tuned in and let's get started. Of you who are new to the channel, welcome, and please don't forget to hit that subscribe button and share with your friends. The alarming thing about the POP or pelvic organ prolapse though is often women are not symptomatic, so they're asymptomatic. So common symptoms that people complain of if they have something a little lower hanging out of their vagina or a POP is that they may feel some heaviness, they may feel that they're sitting on an egg, definitely something's heavy or a little lower than it should be. And then of course, when it becomes out of your vagina, which is a grade 3 or 4, then they say, oh, I actually see something. So that is often quite a progression of your prolapse. One of the things is too that they complain of is that they may feel that they're sort of wiping something and there's a bit of a bulge when they clean themselves in the shower. But here's where the problem lies though. A lot of women are asymptomatic, which is good and not good, because just like if your back is sore, and you've done some improper lifting technique, then your back talks to you and says, hey, you didn't do that right, and you're overworking me, so you need to correct that next time. But if your pelvic floor does not talk to you and doesn't tell you, oh, I feel heavy and there's a bulge just coming out again, then you don't know what you're doing that could be making these symptoms worse or putting pressure on the pelvic organs, and it doesn't talk to you, and then you can't prevent it as much. So this is where I'm going to talk about prevention of a pelvic organ prolapse and what you should be doing regardless of if you have any symptoms or any signs of this. So basically being kind to your pelvic floor is so important. The other tip I want to share with you is, unfortunately, as we get older as women, and amazing women that we are, of course, and we hit those hormonal stages and our collagen decreases as we go through menopause, well, guess what? This area, unfortunately, gets affected too, and that starts to thin. And if you already have symptoms of prolapse and you may not be aware of it, the pelvic floor supports the pelvic organs, and then what happens is these muscles can atrophy or thin, and there's less support on the organs sitting there, and then your symptoms can worsen. So you want to prevent things and strengthen your pelvic floor muscles before that happens. So keep in mind that closed canister idea. So remember, the pelvic floor is the bottom of that canister and the rib cage is the top. So visualize what happens if you even hold your breath and you're lifting, you hold your breath. What's happening, right? So you are increasing the pressure down in that pelvic floor region and also in your back. So that's why they say that when you actually lift, it's called a Valsalva maneuver. You shouldn't be holding your breath, because that can create pressure in your back, which is also not great, and your pelvic floor. So if you increase the pressure here, what happens is you're pushing down on those pelvic organs. And if something is already a little bit low, then what happens is it's going to put pressure on it. And of course, with repetitive heavy loading or pressure, that can actually increase the descent or the level of prolapse. If we take this little balloon here, it might give you a different visual too. See, because I can push this balloon down a little bit more. So what's happening if I hold my breath or I do something that really loads and puts pressure down the pelvic floor and I already have something low? Well, it's going to keep pushing on those pelvic floor organs and it could make them descend down lower. The important preventative advice then is to decrease the pressure down the pelvic floor as much as you can. Whether you have a present prolapse or any symptoms of prolapse, or whether your pelvic floor organs are perfect, just keep that in mind. And I sort of compare it to how you're lifting and your back. Most people know how to lift properly, and actually how you lift properly is similar to what you should be doing for your pelvic floor organs. But most people actually keep that in mind when you lift. So just keep this in mind when you're lifting and performing activities that might put pressure down the pelvic floor region. And you're probably asking, so what kind of things put pressure down the pelvic floor region? Well, the most pressure you'll get on your pelvic floor is repetitive heavy lifting, especially improper repetitive heavy lifting. So if you have any kind of prolapse, I wouldn't recommend that you do repetitive heavy lifting on a regular basis. And I totally get it. I'm a mom and I try to be active and I have to do things like shoveling, unfortunately, things like that, doing the laundry. So if you have to do something and lifting your baby, of course, and they get really heavy, what you want to do is minimize pressure to the pelvic floor by supporting it. And I'll tell you how to do that right now. What you want to keep in mind then is when you're doing any kind of squatting activity or any kind of activity that might put pressure down the pelvic floor, especially lifting, shoveling, doing the laundry, even lifting your baby, is think of recruiting the pelvic floor first. So recruit from the groin up and then pull in those core muscles called the transversus abdominis, which are the key core muscles of the abdominal group that work together or synergistically with the pelvic floor. So everything is being supported and it's minimizing that pressure pushing down the pelvic floor. Okay, so what you want to do is squeeze those pelvic floor muscles, these muscles here, okay, to support the pelvic floor organs. And so start with the groin up and then pull in the transversus. So think of pulling in a zipper, or I think of closing a book or scooping, but from the groin up. So the pressure is going groin up and not pushing down the pelvic floor. And then you're going to breathe out and then lift. Okay, or squat down. So practice that. So engage everything, support, breathe out, and bring everything close, of course, because that's better for your back. And that would be the proper way to manage the pressures in the pelvic floor. So let's do that together, okay? So let's initiate, engage the pelvic floor first. So we're pretending that we're gonna lift, let's say the laundry, okay? So engage the pelvic floor. So it's an in and lift of the pelvic floor up towards that pubic bone, and then keep going to recruit those transversus abdominis muscles, which is the core deep abdominals. Okay, so it's that zipping up or pulling in and underneath your ribs, and then as you breathe out and everything's engaged, you bend down and lift, keeping your back straight. As I mentioned earlier with respect to prolapse, the scary thing that I see in the clinic is often women aren't symptomatic, so they don't know it's there. And then they're not careful with lifting, and that puts more pressure on those pelvic organs. I like to create analogies with respect to the POP and back pain, especially disc bulges or disc herniations. Because often what happens with discs and with your back, you'll often hear people who say, well, I just picked up a piece of paper and then my back went out. But it wasn't that piece of paper that you picked up. It was the accumulation of bad posture, bad lifting techniques, not taking care of your back, et cetera, et cetera. So often that's what happens with the pelvic floor, with the POP. So here you have, remember that little cystocele or bladder saying hello, but let's say it's not quite out there. So what happens is this person doesn't quite know that they have a prolapse, and then they're lifting improperly, their job is lifting, they're not taking care, they're not doing their Kegels, and all of a sudden it gets lower and lower. And guess what happens? Oh, it comes out and says hello, okay? So we want to prevent any kind of descent. And if you have a small descent, you want to prevent it from coming out and saying hello. So the key is, again, minimize pressure to the pelvic floor. Be aware of it. If you don't have symptoms, unfortunately, it doesn't talk to you. But if you do have symptoms, then you know what it feels like. I myself have a small little prolapse, and I can tell when I've done something that is increasing pressure to my pelvic floor. So luckily it talks to me, but mine isn't that bad, but I know it's there. So the key is also, remember, don't forget to look at yourself, okay? Especially standing up when you have the force of gravity, or at the end of the day, or you've done your normal day, which is maybe walking, going for a run. Just check things out to see, where are they? What is my base level? So I have an idea. Even if I don't feel I have any symptoms, just check it out. And again, that's in my video, of course, Female Anatomy 2. And I think I talked about it in the POP video too. So the key tips with respect to prevention of the POP, remember, is know where your baseline is. So you know what your anatomy is before, okay? But also minimize pressure down the pelvic floor by doing that squeeze in and lift of the pelvic floor first, pull groin up, then your transversus, and breathe out and never hold your breath. And of course, getting those pelvic floor muscles working and increasing the tone so they plump up and support your pelvic floor. So they are more hypertrophy, which means that they have more muscle bulk, kind of like a really strong bicep, which mine is not anymore. I'm not lifting that car seat anymore. And so you have that bulk, so it holds up those pelvic organs more and supports them more. So if you had that bladder, it holds that up a little bit more. Okay, so working those pelvic floor muscles and engaging them functionally. So what happens when you work the pelvic floor muscles? Like any muscle, it increases in bulk and it's called hypertrophy. So here's a weak muscle, okay, it's smaller. And then what happens is this muscle is the same, but we've worked it. So it has grown in size, it's called hypertrophy. So you can see what happens now is, now I wish I had 4 hands, but this is not gonna support the muscle as much as this because it is supporting it more. And what happens is then the pelvic floor muscles have better tone, and you've heard of muscle tone, and it'll support things more and lift things up. And the other thing, if you work the pelvic floor muscles, that'll increase your tone and keep things a little less open vaginally, this opening, like Virginia does, because she's been stretched a lot with her multiple kids. And again, that'll prevent other things from happening, such as vaginal farts, which I talk about in another video. But as you can see, it'll close things up and lift things up more. So I really hope that you've enjoyed this video about preventing those POPs or pelvic organ prolapse. I'm gonna talk about more specific exercises, of course, in another video, but please remember to check yourself out, minimize pressure to your pelvic floor regardless of if you have a POP or not, and get those pelvic floor muscles working really well so it bulks up and supports everything and keeps them as healthy as possible and prepares you for those fun menopausal decades to come. So Virginia, I thank you so much for tuning in again. And please don't forget to hit that subscribe button and tell your friends. And we so look forward to seeing you again soon.